Hello and welcome to Medical Dialogues. I'm Anshika Mishra. Here's what I bring to you from the world of medicine. Gout tied to elevated 10-year risk of heart attack and stroke, study reveals. A large population-based study from South Korea has found that people with gout remain at a significantly higher risk of major cardiovascular events over a decade, even when long-term changes in blood pressure and cholesterol are taken into account. Researchers reported that worsening of these risk factors over 10 years further magnify the likelihood of stroke, heart attack, and death. Gout is a chronic inflammatory condition characterized by elevated uric acid levels and recurrent attacks of painful arthritis. While its connection to cardiovascular disease has been suspected for years, the study offers one of the most comprehensive assessment of how the disease interacts with evolving risk factors over time. The investigation, published in Rheumatology and led by Dr. Byeongzu Ghang of Division of Rheumatology at Jeju National University School of Medicine and Jeju National University Hospital, analyzed data from the Korean National Health Insurance Claim Database and the National Health Screening Program. It included 113,853 adults newly diagnosed with gout after January 2012 and more than 1.1 million age and sex-matched individuals without gout. All participants were followed for 10 years to track changes in cardiovascular risk factors and the occurrence of major adverse events. The results showed that gout independently predicted serious cardiovascular complications even after accounting for baseline risk factors and their changes over a decade. Patients with gout had a 50% higher chance of cerebral hemorrhage compared with controls. The risk of cerebral infarction, which is the ischemic stroke, was 36% higher in the gout group. Myocardial infarction risk was elevated by 39% among those with gout. All-cause mortality was modestly but significantly higher with a 7% increase. Worsening diastolic blood pressure over 10 years was linked to greater odds of both myocardial infarction and cerebral infarction. Rising total cholesterol level during the same period were associated with an increased risk of cerebral hemorrhage. These findings highlight the importance of monitoring long-term trends, not just single-point measurements, when managing cardiovascular health in gout patients. The authors stress that the effective control of traditional cardiovascular risks such as blood pressure and cholesterol remains crucial in people with gout, but it may not be enough on its own. Gout itself appears to confer an additional burden of cardiovascular risk that persists even after accounting for baseline health and decade-long changes, they noted. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.